Can colonography replace a traditional colonoscopy? Imagine a test that can give you a detailed look inside your colon without the need for sedation or a long recovery. That's what colonography, also called virtual colonoscopy, offers. It uses a special type of scan to create images of your colon and rectum, helping detect polyps and signs of cancer. It's less invasive and often better tolerated, especially for older or frail patients who might find traditional colonoscopy uncomfortable. The procedure is quick, usually taking about 10 to 15 minutes, and you can go back to your normal activities right afterward. It's also less costly and involves a lower risk of complications like colon perforation. Plus, it can reveal other issues outside the colon, such as vascular problems or other cancers, giving a broader picture of your health. However, despite these advantages, colonography cannot fully replace a traditional colonoscopy. One major reason is its lower sensitivity for small polyps, especially those under 6 millimeters. While it is quite good at detecting larger polyps of 10 millimeters or more, smaller ones can be missed. This is important because even small polyps can sometimes develop into cancer over time. Another limitation is that colonography does not allow for immediate removal of polyps or tissue sampling, known as biopsy. If the scan finds something suspicious, you will still need a traditional colonoscopy to remove the polyp and examine it under a microscope. This means that colonography is mainly a screening tool, not a diagnostic or therapeutic procedure. There is also the issue of radiation exposure, although the dose is low. Still, repeated scans over time could add up, which is a consideration for some patients. Additionally, if abnormalities outside the colon are detected, it might lead to further testing that could cause unnecessary worry or procedures. Current guidelines recognize colonography as a useful screening option, especially for those who cannot undergo traditional colonoscopy due to health issues or personal preference. It is often recommended as a first step, with follow-up colonoscopy reserved for cases where polyps are found or if the scan is inconclusive. This hybrid approach helps balance the benefits of early detection with the need for definitive diagnosis and treatment. In summary, colonography is a valuable, less invasive screening method that can help catch colorectal cancer early. But it cannot replace traditional colonoscopy entirely because it lacks the ability to remove polyps on the spot and is less sensitive for smaller lesions. For most people, a personalized screening plan developed with their healthcare provider is the best way to stay proactive about colon health. Regular screening, whether by colonoscopy or colonography, remains key to preventing colorectal cancer and maintaining overall digestive health. Always consult your doctor to determine which method suits your individual needs and risk factors.